This section will discuss work with families and in particular communicating with parents and guardians. Just to consider some questions before we talk further about communication with parents and guardians. To begin with, thinking about why is HIV seen as different to other chronic illnesses? And in thinking about that difference, how do we as professionals, without meaning to, perhaps support the ongoing stigma around HIV by treating it differently to other chronic illnesses and talking about it in a different way? And with that in mind, how can we think about our communication and how we communicate effectively with parents and guardians to normalise our response to HIV in families? So what we're really saying here, that there's a need to reduce this difference in the way that HIV is treated and responded to in terms of the way we talk about it with children and their families. And this idea of normalising our response to HIV, we see as being a really important approach to how we can better equip children and their families to live well with HIV, to accept HIV. And thinking about this approach to HIV, how it's talked about, normalising HIV needs to happen in professional settings, so clinics, social services, youth support organisations. How are you treating HIV very differently in the ways in which it's spoken about in these settings? And can you look at changing that so that your response to HIV is more similar to the way you would respond to other chronic health conditions? How can we work to normalise HIV in family and care settings? So how can we support families to feel more able to be open in talking about HIV at home? How children and adolescents can be supported to take their medication in an open environment, and how children and adolescents can be supported to tell other people in their families about their HIV when the time is right for them in order that they can be better supported. We're also talking about a need to normalise HIV in social settings, so in places such as schools, colleges, universities. What sort of awareness of HIV is there in these establishments, which mean that increased awareness means HIV will not be thought of so differently from other viruses or chronic health conditions. But beyond that, what work can we do with media, with public health campaigns and messages to ensure that HIV is understood in a normalised way and not treated as being so different? And so what we're really thinking about here is this normalising happens in conversations about HIV. And it's really important to consider that when you think about your work with children and their families. And it's about how knowledge and understanding of HIV is shared with children. And what sort of words are you using to describe HIV to children and helping families talk about HIV at home? So again, just to think here a moment about this idea that we can tend to treat HIV a bit differently, like you just to sort of reflect yourselves for a moment and think about how other chronic illnesses in childhood are responded to. And the question for you is, what do you think is different when you compare this with HIV? Just take a moment yourself to think, what is different when you compare the way other chronic illnesses are responded to, comparing it with HIV? And perhaps share some of your initial responses in the text chat facility so that others can see too. I'll just pause for a moment to let you share some of your thoughts. And moving on from thinking about what's different, what What would it be like if you were able to have a completely open approach to children's knowledge about HIV from the beginning, and the way in which you talk about HIV with them and with their families? How would being completely open with regards to knowledge about HIV with the child and their family feel different for you? How would it feel if you were able to be completely open? So HIV is spoken about in a very free way with the child, with their family. Perhaps share some thoughts about what you think would be different, how it would feel different if that were the case. And again, use the text chat facility so that other people can see the thoughts of others. And these reflections are really just encouraging a reflective practice in the work that we do. It can become very easy to develop habits, which mean actually you can rarely speak about HIV. You may find yourself discussing health issues, or whether medicine is being effective, and talking about blood and immune systems, without meaning to, or perhaps just because it seems to feel more comfortable. The word HIV can often be avoided even in conversations about health. And we would suggest that we need to be very cautious and very careful that we aren't avoiding, and that we are actively seeking opportunities for open, honest conversations with children and their families about HIV. And we suggest that in order for children to accept their HIV, they need regular conversations with different professionals, which are openly, explicitly about HIV, ensuring that their knowledge, understanding, but critically their acceptance of their HIV is supported. And we suggest also that they will benefit from having such open conversations with their families. Now, in order to support this, professionals need to feel very comfortable actively raising HIV in a conversation with a child, with their parents, with their carers. You being the person that brings the topic up, not waiting for them to take the lead. And in doing so, we suggest that you would be working towards normalising their care and support so that it's more similar, closer to how another chronic illness or another viral infection might be being responded to. And so that HIV is treated less differently as we become more confident and comfortable in actively raising conversations about HIV. So we're suggesting here that you model openness to parents and guardians, you demonstrate to them, we can talk about HIV, it's okay. We don't need to be afraid, uncomfortable. We don't need to avoid this. We can just talk about it. It's just a virus. Be very confident, be relaxed, and be comfortable in the way in which you speak about HIV with children and with their parents and their carers. So summing up this last section, we're really talking here about a whole family approach and suggesting that an important feature of understanding HIV-related issues for adolescents is considering their family or care context. We're thinking about their relationships. We're thinking about how HIV is affecting and featuring in those relationships. What behaviours and understanding of HIV are demonstrated at home? How is HIV understood? Do you know? Have you found out? What beliefs about HIV medicine are held in the family or in the care context? And this could be critical in terms of addressing potential issues that a young patient may have with their medicine. What messages are they getting at home? How are other people around managing medicine? Is anyone else taking medicine in the home? What is the family story of HIV? What are their experiences? What impact is this having on them? Has this been explored? For example, has there been any loss of family members previously? And what wider support is available to the family? Is there anybody who's helping them talk about their experiences, helping them come to terms with these? If there isn't, what can you do about that? What opportunity for conversations do you have with wider family to help them better accept HIV, be better equipped to talk about HIV, and ultimately support the child and adolescent who's living with HIV? So a needs assessment should include how family work may meet identified needs for the adolescent. And it's important always to think about this wider context, this family context, because these relationships with family members and other significant people may well hold important information when you're trying to address a presenting problem, for example, a medication adherence problem, or a risk-taking behaviour problem, or emotional difficulties. Roots of many of these issues may well lie in the way in which the young person, the adolescent, has experienced their family relationships. So family work is critical. So that is the end of our first webinar. We very much hope that you've found it useful and that you felt able to contribute. We would welcome your views and feedback, so please do get in touch with us following this. Importantly, to make any suggestions about future topics you would like covered in the webinar series. We really would like to respond to the sorts of things you feel would be helpful. Our next webinar will be run in June. We will provide the date shortly, but that topic we've already agreed we will look at medication adherence. But what we would like to do then is, instead of focusing on providing a lot of information, we are going to specifically look at a case. So we're going to explore a case where there's been some medication use and look at how different responses may help with a particular case. So if you have a case yourself that you've worked on where medication adherence was one of the presenting problems and you think it would be a useful case to share, please do send it to us within the next week or 2 weeks, and we would be very happy to incorporate it in our plan for the next webinar. Many thanks.